Diabetic retinopathy (DR) is a progressive and multifactorial retinal vascular complication of diabetes mellitus, which represents a leading cause of preventable blindness globally. The pathogenesis of DR involves the chronic hyperglycemia-induced dysfunction of retinal microvasculature, leading to a cascade of pathological changes. The elevated blood glucose levels cause endothelial cell damage, promoting the formation of advanced glycation end products, AGEs, and provoking oxidative stress. This results in the disruption of the blood-retina barrier, increased vascular permeability, and subsequent leakage of plasma constituents into the retinal tissue. As the disease progresses, the retina undergoes ischemic changes, triggering retinal hypoxia, which stimulates the production of proangiogenic factors such as vascular endothelial growth factor VEGF. The upregulation of VEGF leads to the formation of new, fragile, and dysfunctional blood vessels, neovascularization, on the retina and optic disc, further exacerbating retinal hemorrhages, fibrosis, and retinal detachment. In the later stages of DR, these pathological vascular changes can lead to irreversible vision loss due to macular edema, vitreous hemorrhage, or tractional retinal detachment. Diabetic retinopathy is classified into non-proliferative diabetic retinopathy (NPDR) and proliferative diabetic retinopathy (PDR), with the latter representing a more severe stage of the disease. Early detection through comprehensive ophthalmic evaluations, such as fundus photography and optical coherence tomography (OCT), is crucial for timely intervention. The management of DR includes strict glycemic control, anti-VEGF therapy, laser photocoagulation, and, in severe cases, vitrectomy surgery to prevent further retinal damage and vision deterioration. Diabetes is a chronic metabolic disorder characterized by elevated blood sugar levels, hyperglycemia, due to either insufficient insulin production or the body's inability to effectively use insulin. Over time, uncontrolled blood sugar levels can lead to serious complications, particularly in organs with high blood flow, such as the eyes. The effects of diabetes on the eyes are significant, as sustained hypoglycemia damages the delicate structures of the retina, leading to vision-threatening conditions like diabetic retinopathy. Hashtag blood sugar and the retina. The retina, the light-sensitive tissue at the back of the eye, is responsible for capturing visual information and sending it to the brain for interpretation. It is highly vascular, meaning it has a rich network of blood vessels that nourish it and help it function properly. When blood sugar levels are chronically high, the blood vessels in the retina become damaged, leading to a cascade of changes. 1. Endothelial damage and vascular leakage. Elevated blood sugar can cause damage to the endothelial cells that line the blood vessels, making them more permeable. This leakage of fluids, lipids, and proteins can cause retinal edema, swelling, particularly in the macula, the central part of the retina responsible for sharp vision. 2. Microaneurysms. The damage to small blood vessels leads to microaneurysms, which are small outpouchings of the vessel walls. These can leak blood into the surrounding retinal tissue, causing hemorrhages. 3. Hypoxia and neovascularization. As retinal blood vessels become blocked or damaged, areas of the retina can become deprived of oxygen, hypoxia. The retina responds by releasing vascular endothelial growth factor, VEGF, which stimulates the growth of new but fragile blood vessels. These new vessels, neovascularization, can grow on the surface of the retina and optic disc, leading to further complications, such as vitreous hemorrhage or retinal detachment. 4. Retinal ischemia and fibrosis. Prolonged ischemia, lack of oxygen, in the retina can trigger fibrotic tissue formation, leading to the development of scar tissue that can distort the retina, further impairing vision. Hashtag types of diabetes. There are two main types of diabetes, both of which have significant effects on the eyes. 1. Type 1 diabetes. Type 1 diabetes is an autoimmune condition where the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. As a result, individuals with type 1 diabetes are unable to produce insulin, a hormone essential for regulating blood sugar levels. People with type 1 diabetes must rely on external insulin administration to control their blood sugar. This type of diabetes typically manifests in childhood or adolescence, but can occur at any age. Due to the long duration of the disease and the need for insulin management from a young age, individuals with type 1 diabetes are at a high risk of developing diabetic retinopathy and other ocular complications. 2. Type 2 diabetes. Type 2 diabetes is the most common form of diabetes and typically develops in adulthood, although it is becoming increasingly common in younger populations due to rising obesity rates. In type 2 diabetes, the body becomes resistant to the effects of insulin, or the pancreas is unable to produce enough insulin to maintain normal blood sugar levels. Unlike type 1, people with type 2 diabetes may not initially require insulin treatment, and the condition can sometimes be managed with oral medications, diet, and exercise. However, over time, prolonged hyperglycemia in type 2 diabetes can lead to similar retinal changes and vision loss as seen in type 1 diabetes.
Diabetic retinopathy often develops without noticeable symptoms in its early stages. However, as it progresses, certain signs may appear, indicating damage to the retina. Early detection is key to preventing further vision loss. 1. Blurred vision. Blurred vision occurs when high blood sugar causes swelling in the retina, distorting its structure. This can lead to intermittent blurriness, especially during tasks like reading or night driving. It may worsen over time, particularly in diabetic macular edema, DME. 2. Floaters. Floaters are small specks or cobweb-like shapes in your vision caused by blood leakage into the vitreous, eye fluid. This can happen when damaged blood vessels in the retina leak or rupture, casting shadows on the retina and making floaters visible. They may vary in size and can obstruct vision. 3. Dark areas in vision. Dark or shadowy spots in vision occur when areas of the retina become oxygen-deprived, ischemic. These blind spots may obstruct parts of the field of vision and become more pronounced with progression, particularly in proliferative diabetic retinopathy, PDR. Additional symptoms. Night vision issues. Difficulty seeing in low-light conditions. Faded colors, a diminished ability to distinguish colors. Sudden vision loss, due to retinal hemorrhages or macular edema. If any of these symptoms occur, it's important to consult an eye doctor for a thorough examination and early intervention.
Diagnostic procedures for detecting diabetic retinopathy. 1. Detailed eye exam. A comprehensive eye exam is the first step in detecting diabetic retinopathy. The eye doctor will assess visual acuity and examine the retina for signs of damage, such as swelling, bleeding, or abnormal blood vessels. This may include a dilated eye exam where eye drops are used to widen the pupils for a clearer view of the retina. 2. Ophthalmoscopy. Ophthalmoscopy is a technique where the doctor uses a special instrument called an ophthalmoscope to examine the retina and optic nerve. This allows them to check for early signs of diabetic retinopathy, such as microaneurysms, hemorrhages, and swelling. 3. Fluorescein angiography. Fluorescein angiography involves injecting a dye into the bloodstream, which highlights the blood vessels in the retina. A special camera captures images of the retina as the dye moves through the vessels. This procedure helps identify leakage, blockages, or abnormal blood vessels, aiding in the assessment of the severity of diabetic retinopathy.
Treatment options and strategies for managing diabetic retinopathy. A laser treatment. Focal laser treatment. Targets and seals leaking blood vessels. Often used for diabetic macular edema DME. Panretinal photocoagulation. PRP treats proliferative diabetic retinopathy, PDR, by shrinking abnormal blood vessels and preventing neovascularization. Vitrectomy. Surgical procedure to remove the vitreous gel and scar tissue in cases of significant bleeding or retinal detachment. Helps restore vision and prevent complications such as permanent retinal damage. Anti-VEGF injections. Injections of anti-VEGF drugs, e.g., ranibizumab aflibercept to block VEGF, which promotes abnormal blood vessel growth. Reduces macular edema and prevents the formation of new fragile blood vessels, helping to preserve vision.
Thank you for watching. If you enjoyed this video, please don't forget to like, share, and subscribe to our channel for more educational content. Your support helps us bring more insightful videos on medical and technological topics. Please leave a thoughtful comment in comment section below. Thank you and take care. Maams Medical.